students. Welcome to the platform of egurukul. Myself, I am Dr. Ramyasree. I teach obstetrics and gynecology. So, I am going to discuss all the recent updates of Williams 26th edition in this video. So, I tried to compile all the updates from all the chapters. Should I be panicked by the updates? Not required. This video will reach all the updates to you, and this is what is required for you. So obviously there are so many chapters in the Williams, but it is not like for an undergraduate you should know every chapter, like fetal imaging, fetal therapy, genetic patient. So those are all like, for an undergraduate it's not at all required. So I feel you should know those things which are required for you, and those questions which will come for you. There's no point to master the Williams now, because once you pick up OBGYN as a uh, subject, definitely you're going to master it, right? So yes, we are going to discuss what are important for us and what have been asked for us, and what are the changes present in those. Now, before that, I have already done one video of WHO Labor Care Guide. There are certain changes in the WHO Labor Care Guide. I hope you all have watched that video, and we have made it free by keeping it in the YouTube also. So definitely watch that video, WHO Labor Care Guide. So in WHO Labor Care Guide, the when is the active phase starting, and what is the duration of active phase, and what is when do you call second stage cutoff given by WHO. These are all certain changes in the labor chapter, so that have been mentioned in the WHO Labor Care Guide. So definitely watch that video, right? So now first chapter which I'm going to deal in this video is pregnancy and antenatal care. So I'm going to mention all the updates pertaining to pregnancy and antenatal care. Now guys, I'm not going to teach you the entire chapter. I'm going to just discuss the updates what we have, or what you have to change in your notes, or what you have to add in your notes from your previous notes. See, because when I change entire videos, it might be difficult for you at this point of time to see the new videos. So that is why I'm making this video, taki you can just add these points into your notes and continue with the same previous notes, right? So first chapter which we are going to discuss the changes are, or the additions are, pregnancy and antenatal care. So in the pregnancy and antenatal care, the first thing is, so in this we are also supposed to know how to estimate the gestational age, right? So we all know that we estimate the gestational age with the help of Naegeli's formula, right? So that is LMP plus 9 months plus 7 days for a 28 days regular cycle, or you can do modified Naegeli's, that is LMP minus 3 months plus 7 days. That's the modified Naegeli's formula, right? Now, he also mentions how we are supposed to check for the expected date of delivery in IVF pregnancies. So in IVF pregnancies, you have to see, basically we all know that there is ovulatory age and gestational age. So gestational age is 280 days. That is from the LMP till the expected date of delivery is 280 days. Ovulatory age means you minus that 14, 266 days. है ना? Now in IVF pregnancies, we only know, let us take that we almost always doesn't know her LMP, and even if we know also, from there we are doing the ovulation induction for her. So that first half might be it might be variable, because you might be giving protocols, different antac protocol, agonist protocols, right? Or sometimes you just do the direct embryo transfer, you freeze the embryos this pregnancy and you transfer in the next pregnancy. So how do we calculate the expected date of delivery for those patients? So in IVF pregnancy, if you have done egg retrieval, so egg retrieval or fertilization date, so that egg retrieval and fertilization will be done on the same day. So if you have an egg retrieval date or fertilization date, that means the previous follicular phase or the 14 days are over, right? So from then you have to add 266 days to get the expected date of delivery. So whichever day egg is retrieved or whichever day the fertilization is done for the woman, from that day you add 266 days to get the expected date of delivery. Next concept is, imagine that you have frozen the embryos for this lady. So if you have retrieved the egg and fertilization, and once the embryos are there, you have frozen it and you're transferring it in the next cycle. So then this formula is not valid, no? Because egg was retrieved last month and embryo was frozen, and now again you are transferring it. So in such cases, you can take from the day of embryo transfer. If you're doing day 3 embryo transfer, it means after fertilization, 3 days are already over. So how many days you'll add? Very good, 263 days. So if you are doing day 3 embryo transfer, so day 3 embryo transfer plus 263 days will give you expected date of delivery. If you are doing day 5 embryo transfer, so day 5 embryo transfer plus 260, you have to minus another 2 days. So 261 days will give you expected date of delivery. So I hope all of you understood this concept. So in IVF pregnancies, we don't have all this. We cannot use the Naegeli's formula. So either if it is a fresh cycle, in that egg retrieval or fertilization date plus 266 days you will add. If it is an embryo transfer cycle, so day 3 embryo transfer means you have to add only 263 days. If it is day 5 embryo transfer, you're going to add 261 days to get the expected date of delivery. Next, one more point which is mentioned in the Williams is, best way to estimate the expected date of delivery is USG. Okay, so the best way to estimate the expected date of delivery is ultrasonography, guys. Okay, next. So in total, there are 4 trimesters. So the second update. So earlier we have always discussed key we have 3 trimesters, we have 3 trimesters. So now it tells that we have 4 trimesters. So first trimester is completion, up to completion of 14 weeks. So it is up to 14 weeks. Second trimester is from 14 plus 1 to 28 completed weeks. So third trimester is from 28 plus 1 to 42 weeks of gestation. Fourth trimester which has been added is post delivery up to 12 weeks. So this is change number 2. So according to him, what he tells is like every trimester is having 14 weeks now. And fourth trimester is like a pure perium. So post delivery up to 12 weeks is also, he has written it as a trimester. And usually pure perium we used to take up to 6 weeks, but he's telling now post delivery up to 12 weeks. So first trimester is up to 14 weeks. Second trimester is 14 to 28 weeks. Third trimester is 28 plus 1 to 42 weeks of gestation. And fourth trimester is post delivery up to 12 weeks. Next, recommended weight gain also. It is almost similar to what we have learned previously, but I'm just writing the updated for you. So recommended weight gain. On an average in India, we always tell 11 kgs, 1 kg in the first trimester, second and third trimester 5 kgs, right? So recommended weight gain for underweight 12.7 to 18.1. It's very yuck to remember, like points and all that. I really don't like. So we'll remember round finger of 13 to 18 kgs. Normal weight, this is not a major difference, guys. We used to tell 14 to 18, 13 to 18 also fine. Normal weight 11 to, if the normal BMI, if they have normal BMI 11 kgs to 15.8 kgs. If they are overweight, it is 7 kgs to 11 kgs. This is same. And if they are obese, 5 to 9 kgs. Okay. Next. So there was one time a question which has come ki what is the postpartum, which element postpartum requirement increases. This was asked in the NEET where we all went through the answer of calcium. But now I'll just write the recommended dietary allowances of certain things which have been changed from the previous Williams. So, recommended dietary allowance in pregnancy and lactation. So, for vitamin A in pregnancy, it is 770 micrograms. In lactation, it is 1300 microgram. Calcium, previously used to write 1200 here and lactating 1000 in pregnancy and 1200 to 1500 in lactating. But this Williams is given pregnancy also 1000 milligrams, lactation also 1000 milligrams. Next, iron 27 milligrams in pregnancy, 9 milligrams in lactation. Iodine 220 micrograms and lactation में 290 micrograms. So basically if you see lactation में vitamin A is requirement is almost double. So vitamin A requirement in lactation will be doubled. Okay. And a special emphasis is given on vitamin D supplementation. So in our notes we always write about calcium, iron and folic acid. So please also add vitamin D also now. So what they have mentioned is whenever mother has vitamin D deficiency, then mother there can be skeletal homeostasis in the baby. There will be congenital rickets. Fractures in the newborn. So that is why vitamin D has to be supplemented to all mothers. So vitamin D supplementation as per the Williams should be along with the calcium, do the vitamin D supplementation. It should be 600 international units per day. It should be 600 international units per day, right? Next, even in the investigations, there are certain changes in the investigations. Okay. So coming to the prenatal investigation. So at the first visit and subsequent visit, what are all the lab tests which you are supposed to do? So that is the next change. So in the lab tests, routinely we used to do hematocrit or hemoglobin. So hematocrit or hemoglobin at the first visit, 15 to 20 weeks, 24 to 28, 29 to 41, right? So lab test at the first visit, 15 to 20 weeks, 24 to 28 weeks and 29 to 41, right? So hematocrit should be checked in the first visit and again repeated at 24 to 28 weeks, right? So blood grouping and typing, yes, first I'm writing what we already know at the first visit. Next, glucose tolerance test, OGTT, at the first visit and again we repeated 24 to 28 weeks. Next, we do normally the urine culture. So urine culture, we do urine routine, but yes, urine culture is what is advised. So at the first visit. Next, HIV, HBsAg and VDRL at the first visit. So this is what we routinely do, and I always tell Williams also tells to do the pap smear. So this is what routinely we do. Now additional to these what are added are, so pap smear should be done in the pregnancy. Pap smear should be done at the first visit. So pap smear to be done at the first visit. Next, offer aneuploidy screen. It means it is not like mandatory, but you offer them. Offer the aneuploidy screening and neural tube defect screening. So aneuploidy screening in the first trimester between 11 to 14 weeks, whereas neural tube defect screening, that is by maternal serum alpha fetoprotein, that is between 16 to 20 weeks. Okay. Next, even rubella serology is added, guys. So they are telling that along with the syphilis and HIV and HBsAg, do rubella serology, gonococcal screening and chlamydial screening are for high risk women. Chlamydial screening. So rubella serology is something which has been added new. Along with rubella serology, gonococcal screening and chlamydial screening, are for the high risk women. So high risk women, you have to screen these, not for all. So high risk women should be screened. Okay, for the gonococcal and chlamydial, it is the high risk women. Actually, chlamydial is given for all women, whereas gonococcal is for the high risk women. Chlamydial screening for all women, whereas gonococcal for high risk women. So this is something added for, according to ACOG, so according to Williams, but we are not doing it in India. I'm just telling these are the things which are added. I'm not telling you have to do. Next, they have also added that Group B, do Group B streptococcal screening. Group B streptococcus culture. So earlier we used to do only if they have PROM or preterm labor, right? So Group B streptococcus culture. So we have to obtain for all women rectovaginal culture between 35 to 37 weeks. So this is a new thing. So for all women, Group B streptococcal culture, that is rectovaginal culture between the 35 to 37 weeks. If it is positive, we have to give benzyl penicillin prophylaxis, right? Next, in high risk patient, tuberculosis. So high risk women, again, you have to do tuberculosis screening at the first visit. So these are certain things added in the lab test, guys. So these are certain things added in the lab test. So what are all the new updates in the lab test? So offer aneuploidy and neural tube was there before only. Pap smear testing also was there before itself, right? So what is new is rubella serology. Rubella serology is something which has been added. Gonococcal screening for all high risk women is something new, right? Chlamydial screening. Group B streptococcal culture between 34 to 39 is something again, something 35 to 37 weeks. Sorry. Group B streptococcal culture between 35 to 37 weeks and tuberculosis screening for high risk women. Okay. So in rubella screening, women will be tested for the IgG antibodies. So in rubella screening, female will be tested for the presence of IgG antibody to rubella. So if she is positive, she is immune. If she is negative, then she is susceptible, guys. Then she is susceptible to the infection. Even if she is susceptible to the infection, it doesn't mean that now you have to give the vaccine to protect her, because you cannot give MMR vaccination or rubella vaccination is contraindicated in pregnancy because it's a live vaccine, right? But unknowingly if you give, she can continue, but don't give her wantedly in the pregnancy. Next is that if somebody has received rubella vaccine, if somebody has received MMR vaccine or rubella vaccine, then they should delay the pregnancy for 1 month. So these are all the additions which I want you to do in the chapter of pregnancy and antenatal care in your notes. Okay, right? I hope all this is crystal clear. So rest also, there are certain changes in the miscarriage chapter, hypertension chapter, diabetes chapter. So I'm going to upload those also in the app. Now this is there in the YouTube, so you can all watch it. Yes, and the rest you can watch it in the app. We have made a section called recent updates, and there you can see the other videos also, guys. Okay, so point number 1, how to calculate the in IVF pregnancies the expected date of delivery. This is what you have learned now. Next, there are 4 trimesters. Recommended weight gain, minor changes, just correct it. Lactation में 1300 is now recommended for vitamin A. Vitamin D deficiency has to be addressed and treated. Lab test में do pap smear offer aneuploidy and neural tube defect screening, do rubella serology, do chlamydia screening, and important group B streptococcus culture and tuberculosis screening at the first visit in high risk women. So these are the updates which are there in the pregnancy and antenatal care, guys. So thank you. See you then. I think you liked the way I have compiled it, and it will be easy for you to add to your notes. So similarly, I'll also tell you the updates of hypertension, diabetes, uh, this miscarriage. So I'll just make like this same video. Labor mein WHO labor care guide, that's just you have to incorporate into your notes of the labor chapter. Apart from that, rest whatever you have previously, fair enough. No need to change anything else. Okay. Right. Thank you, guys.